Hello again. How have you been? Looking after your health shouldn't be complicated. The internet is often the first place we turn to for medical advice, but how do you know whether you can trust what you read or hear? Well, here's my promise. This podcast brings you weekly advice that you can actually use and rely on, whether through interviews with experts from the world of health and well-being, or during my conversations with celebrity guests who share their worries and concerns. Make sure you follow or subscribe to make practical health guidance part of your weekly routine, and join us every week for more. On this week's episode, I want to give answers to some of the questions that you've sent to ask@DrHilaryJones.com. That's the email address to get in touch if you need advice on sleep, diet, mental well-being, or everyday medical concerns. First up today, I have a letter from Mavis Bradley, and she asks this. I suffer with Paget's disease, as did my late mother. This has never been talked about on your breakfast television show, but when it comes up in conversation, people always say they've never heard of it, Paget's disease, and they ask what it is. Hopefully, you could highlight this illness at some point. Well, I will, Mavis. Paget's disease of bone is not uncommon, and if I could just explain that our skeleton, the bones in our skeleton, are constantly being renewed. So there are cells called osteoclasts, which break the bone down, and osteoblasts, which lay new bone down and remodel the bone itself. But in Paget's disease of bone, this balance becomes a bit dysfunctional, so that the bone is broken down too much, and the osteoblasts, which try to restore the balance, work overtime, but that leads to weakened bones and sometimes deformities, so that the bones can become bigger as they reform. And this causes pain in the bones affected. It can cause warm feelings in the skin overlying the bone. It can lead to changes in the bone shape, deformities, fractures. If it's affecting the skull, it can cause hearing loss. Because it affects the bones generally, it can then lead to problems with the joints or osteoarthritis. So it can have a number of symptoms and signs, but sometimes people discover it by chance when they have an investigation for something else, and it's found on imaging that is done, as I say, for something else. But the good news is that there is treatment. Treatment consists of medications such as biphosphonates, so that there are injections called zoledronate that you can have, or if you can't have that, calcitonin by injection as well. These help to strengthen the bone and relieve the pain. Then, of course, there are things like physiotherapy, occupational therapy. There are inserts in shoes you can have. You can have walking sticks and other devices that help. So it's manageable. And of course, sometimes surgery is necessary in more severe cases. So there we are. That's a potted story about Paget's disease of bone, not uncommon. And it does run in families. You mentioned that your late mother had it as well. But there are some solutions there, and the remedies are there. Go and speak to your GP if you need help, and if necessary, be referred to the specialist. So I hope that has helped, Mavis. The next letter comes from Violet Page, and she says, I've been diagnosed with diabetes a few months ago, and I'd like any advice on how to manage it, please. And I'm going to assume, Violet, that this is type 2 diabetes. Type 1 is more of a medical emergency, so you by now know how to manage that. Type 2 is much more common. 9 out of 10 cases of diabetes, of the 3.5 million people in the country who suffer from diabetes, will have type 2. And the way to manage this is to lead a healthy lifestyle, certainly. What's happening here is that either your pancreas isn't making enough insulin, or the insulin that you're making doesn't allow the tissues to respond to it. So that's insulin resistance, and the blood sugar levels rise. And that, if it's not treated and managed, can lead to complications such as heart disease, strokes, kidney problems with vision, problems with peripheral nerves, etc. So that's why it has to be managed. And that's why your question is so valid for so many people. So the key thing is to have regular checks on your blood sugar. Your blood sugar needs to be controlled within narrow parameters to stop these complications occurring. You need to eat healthily. You need to cut back on sugary foods, sugary drinks, on fat and salt. You need to have plenty of fruit and vegetables, and eat whole grains, lots of whole grains, so wholemeal bread rather than white bread, for example, brown rice, oats, that sort of thing. And for proteins, things like pulses, beans, nuts, eggs, lean meat, fish, that's all healthy. And go for low-fat, low-sugar dairy products as well. Exercise is another thing to try and control weight. That's important, but exercising at least 2.5 hours every week as a minimum, more if you can. As I say, control weight. And obviously there are medications as well. So a lot of people start with a medication called metformin to control blood sugar, but there are other things too, including the GLP-1 agonists, which have got a lot of attention at the moment for people looking for weight reduction. These injections were originally designed for type 2 diabetes to control blood sugar, but it does have the additional benefit of losing weight as well. So that's what it's about. It's about regular checkups, healthy lifestyle, and if you adhere to those guidelines, your blood sugars will be under control and your diabetes type 2 will be well managed. And Violet, on a previous episode, I spoke to Colette Marshall, Chief Executive of Diabetes UK, about the warning signs, the risks, and what can be done to prevent type 2 diabetes. You might take a look at this.
I mean, it's the tragedy that's unfolding. In the last 17 years, we've almost seen a doubling in the number of people with diabetes in the UK. And if you take the latest figures, it's saying 1 in 5 adults in the UK now has diagnosed diabetes or has pre-type 2 diabetes, or even more worrying is undiagnosed. Because if you're undiagnosed and you have diabetes, you're not getting the clinical help and support you need to manage your condition. And as you say, that leaves you at risk of the really severe complications that can come with diabetes.
A third question today. My mother is being told she may have to have a hysterectomy after suffering a prolapse. What are the dangers? As she's 85 and recently had a hip operation. She really doesn't want any more surgery. I can understand that. But it is uncomfortable for her, and I think a repair won't last. She has had 4 children, and that's from Emma Curtis. Well, Emma, you're right to be concerned. Your mum's elderly, 85. Prolapse, we're talking about uterine prolapse. And what happens here is that the womb tends to drop down into the vaginal canal, and it can be of various severities. The causes are basically a weakened pelvic floor, which allows things to drop down. And obviously childbirth is one factor. She's had four children. Yeah, you said 4 children, yeah. Also her age, the muscles get weaker generally, including the pelvic floor. And obesity. I don't know if your mum is overweight, but obesity is another factor for many women. This isn't an uncommon problem by any means. About a third of women over 60 and about half of women over 80 will have some degree of prolapse. It's usually divided into 4 stages. So stage 1, there's a little bit of dropping down of the womb into the top of the vagina. And then stage 4 is where the uterus is actually prolapsed outside the body. And this can lead to pain and infection and problems with the bowel, problems with incontinence, or certainly urinary symptoms like frequency, depending on the severity. So there are pros and cons about how to manage this. Normally, if it's a mild stage 1 prolapse, it can be managed without surgery. So, for example, Kegel exercises, pelvic floor exercises, can do a great deal of good and help to control symptoms. But there are also pessaries and rings which can be placed inside to hold the uterus in position, using the ligaments and the bone inside to keep things under control. Surgery if those things don't work. Now, at 85, clearly you're concerned, and it is more complicated as the years go by. But if everything else has been tried and her lifestyle is being severely curtailed by the prolapse, then there may be no alternative. The good news is that the operation may last between 1 and 5 hours, and hospitalisation might be for 1 to 3 days. But these days, the results are pretty good. No, they might not last forever, but at 85, it could make her a lot more comfortable. And with modern anaesthesia, she's in very safe hands. So I hope that answers your question. And the next question comes from Pete Lucas. What's your opinion of Rybelsus, the weight-reducing drug? I've been taking it for the best part of a year. My clinician told me it makes you feel fuller for longer, but in my case, as soon as I take it first thing in the morning, I feel hungry. It doesn't seem to work for me, so I stay dieting like before I started taking it. That's really interesting, Pete, because Ribelsus is the trade name for semaglutide, and Ribelsus is the pill form of the injection of semaglutide, otherwise known as Ozempic. And Rybelsus actually is licensed to treat blood sugar rise in type 2 diabetics. So that's what it's licensed for. And it's not actually licensed for weight loss at all, but it is used off-label for this purpose. So in answer to your question, yeah, it works by helping you to feel fuller for longer. That's what it does for most people, and it mimics a natural gut hormone that does this. It also helps to increase insulin production and delays stomach emptying. So that's why it works for weight loss. But actually, it's not as effective as Manjaro because that works on 2 receptor sites rather than 1. But anyway, if you're finding that it doesn't curb your appetite, and I don't know whether you've adjusted the dose, it's normally taken as a once-a-day pill. It's an extended release tablet, and discuss this with your doctor. I wouldn't want to persuade you to do anything your doctor has not advised you to do. But look, if it's not working for you and you're finding that actually you can control your weight with diet and exercise alone, why take medication at all? There are always going to be potential side effects. And if you're disciplined and can do this through adjusting your diet, through exercising regularly, and just enjoying a healthy lifestyle, I would advise you to carry on right there. That's working for you, and it's a very healthy way of doing it. So good luck to you on that. Now, this letter comes from a TikTok comment, and it's on the Pete Cohen TikTok, actually. The question is this: I have a low-grade version of the same brain tumour. What's the best advice on treatment? Mine is also inoperable. Well, you'll remember that my good friend, Pete Cohen, who's been on this podcast with me talking about happiness, his late wife died of an astrocytoma brain tumour. And Hannah was such a lovely woman, a really brave woman who fought to the end and tried different therapies. And these astrocytomas come from glial cells, which surround nerve tissue either in the spinal cord or in the brain. And depending on the stage will determine, the grade rather, will determine how aggressive they are, how fast growing they are. A lot will depend on the location and the size when it comes to treatment. Some are accessible to surgery, some aren't. But on top of that, we have targeted radiotherapy and chemotherapy, which can come in the form of injections or tablets. So a lot depends on the individual situation, and that'll be determined by the tests that you have, the scans of various types, to ascertain the location and the size. So if it's surgically inoperable, then usually it's radiotherapy and chemotherapy in combination. And results will vary according to your individual situation. But I do hope that that is helpful to you and that you're getting the help that you need. The next question, certainly this is something that I can relate to. I had a hip replacement in April. I have feelings like I'm sitting on something inflatable or jelly-like. I still feel it, but not as much as before. I'd be grateful if you could answer. Thank you. And that's from Kathleen Callahan. I had a hip replacement earlier this year myself. And I think it's fair to say that a hip replacement will largely start to settle down after about 3 months. You're going to be walking well after 3 months usually. You're going to be pain-free and more mobile. But it can take up to a whole year for things to go completely back to normal for some people, depending largely on how fit and strong you were before the operation and how well you do your physiotherapy and get mobilised afterwards. But this feeling that you've got of sitting on something inflatable or jelly-like, this could be due to some division of small nerves which are still being restored and will take up to 9 months. It could be a result of something else, something in your spine that's slightly getting used to the new hip and leg length. It could be a number of reasons, but as I say, it's only been 6 months for you, and you say things are getting better. So as long as you're doing a physio, and if your follow-up X-ray showed that the joint is in a normal position and the artificial hip is working nicely, I certainly wouldn't worry about it. It's getting better. You've got another 3 months before you need to be concerned. Good luck with that. Now, if you'd like me to answer your questions on a future episode, here's the email again. It's ask@DrHilaryJones.com. And before you go, for the latest health news delivered straight to your inbox each week, subscribe to my newsletter at DrHilaryJones.com. We'll keep the conversation going about your health, your well-being, and what truly matters to you.